Hi, I'm Dr. Nicholas Kardaras. I'm the Chief Executive Officer and founder of Omega Recovery. I've been working in the field of mental health and addiction treatment for almost 20 years now. I've been a professor at the graduate level of substance abuse treatment and mental health. I've run clinical programs throughout the country, primarily on the East Coast, and I've written a couple of books about mental health and addiction. And what I found in the industry was that programs that were meaningfully integrating different modalities that could really help people experience the shift to get through whatever challenges they were experiencing. A lot of programs would throw different types of modalities, different types of groups and treatment models at people, but there wasn't sort of this uniform idea as to what's really going on when a person is in distress, when a person's addicted, or when they're going through some mental health challenges. We talk about the person that's in distress, whether that distress is intrapsychic, interpersonal, psychiatric. A person is experiencing some kind of discomfort in their life that they're either self-medicating or they're using problematic behaviors to work through. Or sometimes a person has developed a narrative about their lives that is compelling them to act out in ways that are really not ideal. So each person is different. We call that the perfect storm model of personalities. We have to understand what are the different storm fronts that are coming together to create this human being that we're working with. Are these storm fronts, are they childhood abuse? Are they trauma? Are they psychiatric imbalances? Are they an existential crisis? And once we understand those different storm fronts, we can begin to work with that person to help move them forward. And a lot of the work that we do is experiential. We believe that powerful experiences can create a shift in that person. So if I'm caught in a gerbil wheel, as we like to call it sometimes, if I'm stuck, my stuckedness looks like repetitive self-destructive behavior. And how can I shift out of that? How can I move forward? How can I redefine who I am? A lot of the clients that I work with, they're stuck because they have lacked purpose or meaning in their life. They've lost that. Either they become bored with life, or they had some kind of crisis. A child died, or they've had some kind of illness, and now all of a sudden, or a retirement, or career loss, or job loss. Who am I? What's the purpose of my life? A lot of those folks tend to self-medicate or develop also mental health challenges because of lacking that sense of passion and purpose in their lives. So that person's not going to respond necessarily to an antidepressant pill or to traditional sitting in a chair group therapy. That person's going to need experiences to help pull them out of their malaise and into something more engaging, more challenging, more powerful. So we described a model called therapeutic lifestyle changes, that a lot of people's lifestyles have become toxic. We're sedentary, we're screen obsessed, we're not sleeping properly, we're not exercising, we're not connected to people. And we know to be mentally healthy, we need human connection. We need to be moving, we need to be physically active. We need to have all these elements in our lives to move forward. So sitting in a circle in a group and just talking about that group therapy is a piece of the puzzle, but not the whole puzzle. Unless I can help a client find that passion and that purpose to then be able to avail themselves of the other therapeutic work that we ask them to do, they won't do it. So our purpose here is to find out what makes each client tick, to find out what's underneath their distress, and to get them living again, and to get them moving forward. That's our mission and our statement at Omega Recovery, to help you transform into that person that you were always meant to be, but may have gotten stuck for whatever reason. So I'm privileged and honored to have the opportunity to work with a great team to provide, I think, what can be life-saving services to people. And in the best city in the world, Austin's a great dynamic city that my family and I have moved to, and we are loving it. So hopefully we'll get a chance to help you if you're having any kind of issues as well. Thank you.